the first and foremost, often people will get local symptoms. So we can think about that with all the microbiomes, the mouth, the gut, the vagina, the penis. There'll often be local symptoms of the imbalance. So whether that's pain in the area, when it comes to the mouth, it might be tooth decay. When it comes to the gut, it might be, IBS, IBD, sort of uncomfortable symptoms in the gut. In the vagina, it would be pain, and inflammation in the vagina. So, so that's the local problems that can happen. And then again, when we come back to the gut, then we have to think about it as, because so much goes in and out, via the barriers there, how it then links to our immune system, to our, how it plays a role in what goes in and what comes out. And that can change things like our hormonal balances. It can change things like how our immune system works, how our, our kind of like different kind of, what am I talking about? Metabolic processes like, blood glucose metabolism, things like that can all be disrupted. So then you have all the secondary knock-on effects, basically, of kind of the local damage that happens. Does that make sense?
And what would just be some examples of more systemic conditions that could be caused by an imbalanced microbiome?
So basically, an imbalanced microbiome has been linked with most chronic diseases. So that's everything from metabolic syndrome to autoimmune conditions is a very, very big one. There's lots of links with different autoimmune conditions, skin conditions, if you mentioned earlier, such as eczema and atopic dermatitis and psoriasis. So it's those, and even chronic sort of cardiovascular disease conditions and so on and so forth. So again, it may not be the only causative factor, but it's generally what we call a very, very big mediator of a lot of these problems.
Yeah, and I know the oral microbiome is linked with heart disease, isn't it?
Yeah, absolutely. Heart disease, big one with rheumatoid arthritis as well, the oral microbiome, as well as obviously, local problems too.
Yeah, I was just thinking that, heart disease is the biggest killer in the Western world. And how many cardiologists have a discussion with patients about their oral cleanliness and microbiome? I'm guessing it's probably not that many.
Yeah, and as periodontitis, there's some really clear papers around periodontitis, which is inflammation of the gums with microbial, imbalance, basically, is very much linked with cardiovascular disease and increases the risk. So, yeah, it's definitely worth seeing your dentist.
Yeah, and also root canals are also connected with heart disease, because what you're doing, I don't know if you've looked into this, Debbie, but when you have a root canal, and obviously you're blocking the root canal, what happens is the microbes that live in the tooth, so you have thousands of miles of tubules in each tooth, and you have aerobic bacteria, and when you block off the oxygen, the only way they can survive is to mutate into anaerobic bacteria, and then they start producing really potent toxins, and that's been linked to heart disease.
If you enjoyed this clip, press here for the full episode, and don't forget to like and subscribe. Thanks for watching.